Hi, my name is Dr. Eisenmann.
And I'm Dr. Gaudet.
And today we are going to talk about what is resiliency brain health, and more specifically, what is functional neurology. There's a lot of talk about functional medicine. I think in the past few years, we've really dived deep into other aspects of healthcare, and online, there's just a lot of information. It's almost information overload. And so we get a lot of questions from our patients and potential patients as to what is functional neurology? What do you guys do? And people that look at our website too. So although there is oversaturation on the internet of information right now, we felt compelled to start this series and answer some questions for those of you that are actually seeking this kind of help out there. So in your best definition, what would you say to a person that's looking for the clinic and online as to what do you do? Like, what is functional neurology?
So for us, functional neurology is when a person has had an opportunity to see other types of medical neurologists, and they're at a point where the medical neurologist has said, at this point, I have nothing else for you, but the person still feels that they have functional deficits. Mm-hmm. My sleep isn't where I want it to be. I still have tics. I still have headaches that aren't resolved. They still have symptoms that challenge their daily function. That's where we come in, right?
Yeah.
And so there are many different reasons someone would need a functional neurologist. So
we have a little blurb that we have on here too. So I may read a few of them because this is just a casual conversation and we want to make sure you guys get the best information out there. But we wrote down functional neurology focuses on how the brain functions. It's not just what shows up on imaging or labs. Your brain controls everything from like energy, focus, movement, digestion, immune system regulation, mood. So when function is off, symptoms appear long before disease is diagnosed. We like to also, this is really normal for you and I, for our thought processes. So this is a great exercise for us because we live here. This is what we do daily. Mm-hmm. And so it's hard for us sometimes to imagine a world in which functional neurology is not a part of.
Or people don't understand it.
Yeah.
Right?
And so for us, we find ourselves sometimes talking to people and being like, oh, okay, we have to start from like ground zero and explain these things up. But what people don't understand is that function precedes pathology and structural issues. And so it's really important to actually know how your brain is functioning. And I want you to piggyback off this, but I feel like a lot of people somewhat understand like blood work.
Right.
They don't always get told the best stuff all the time, or interpreted. Something I see a lot from some of you practitioners out there is ordering lab work and then not actually sitting down and explaining it to patients.
Right. In a way that they understand.
Exactly. Right. And but they also don't realize that they may need to do additional testing.
Right.
That is at a physiological. So there is that metabolic blood work component, and I'll have you lead into the other testings and things that we do here too.
So a lot of patients, once they've come in, they've had a lot of blood work, they've had a lot of imaging, they've had a lot of testing. And sometimes, as we discussed, the practitioner hasn't really discussed with them in detail what any of that means. All they were told was, hey, my labs are normal. And there really isn't anything, there's no such thing as a normal lab. There are trends. And a lab value doesn't have to be in the red to be a problem. And so when we're looking at someone's labs, we like to look at several previous labs so we can see the way that the labs are trending, because the goal in functional medicine and functional neurology is to catch something before it's a disease process. We want to see it's trending into an issue, let's get it stopped and reversed, and that way we can get you back into health. So, sometimes those standard labs, somebody will come in with standard labs and we want to do some additional testing because we see something on there. They may have additional viral loads, or they may have GI dysfunction. That's a huge one, because if the gut isn't working, neither is the brain. There's a whole brain-gut connection, right? And so we may want to do more metabolic testing We may, need someone to go out to a sleep lab and do sleep testing because they're having issues there. So there's a lot of additional testing, and we often are basing that off of what your current labs show, what the trending labs before that shows, and then what the symptoms that you're coming in with are at current.
That's perfect, because in the back, we were kind of having this discussion before we sat down and talked. And so you said perfectly that, we're trying to look before disease.
Right.
And that's a common misconception that we see on the internet and with other people. And it's that there is no competition in between practitioners.
Right.
So a functional neurologist and a neurologist or medical traditional neurology, there should be no competition. Actually, we should work very synergistically, because while they're treating pathology,
Correct.
we are trying to prevent dysfunction from becoming disease or pathology. And so I personally, and I know you believe this too, what we want to do is we want to help people in that functional sphere. And so I think we need to define here in a second, like what that functional sphere is, so people can know what to go, what to do. But we want those people with like true diagnosed pathology to have better access to those neurologists that can help with other therapeutics. And we want to help the people in the functional aspect so that there is better resources for everyone.
Right.
So really, should be synergistic. And I guess this is a call to like other professionals out there that, we're willing to collaborate.
Right.
And we love collaboration.
Yes.
So,
because we can't fix everything.
Yeah.
Right? That's not it at all, nor do we want to.
Yeah.
We really want to work with those other practitioners. And we have a whole group of practitioners that we work with already, but the practitioners will call and say, hey, I'm kind of stuck. I know that this person's being treated for this and this, and I know what they're dealing with is no longer that pathology. There's something else there. And so that's a great time to refer, because that something else is almost always functionally related.
Yeah.
Right? There are things that can be helped and aren't necessarily, needing a medication or something else. Sometimes it just needs to, hey, how do we stimulate that brain to get it to start to do the things that it was designed to do?
Yeah, that's wonderful. So what would, if someone came and was like, all right, I'm watching this video and I don't know that I understand, like, how do I classify myself as a person in the functional sphere? And at what point, because that's confusing, right? And the lingo out there is confusing for some people. I know we had to go to school to figure that out. So what would be some of the people that you say would classify, like, hey, you may want to give an attempt to a functional neurologist first? And at what point do we say maybe you do want to start? And I don't think there's a right and wrong. I think we have to collaborate and refer to each other. But for the layperson out there that's looking at this and doesn't understand, okay, who goes to see you?
Right. So we have, that's great. So we have people that want to just improve cognitive function. Some people come in and say, you know what? My memory used to be great. I'm great at numbers. I can't really do that anymore. I just don't feel quite as sharp as I used to. So somebody that's wanting cognitive performance enhancement, right? They just want their cognition to be better. We have people that have had vascular episodes, so things like strokes and heart attacks, and their function is no longer where they want it. So they did, they were at the hospital, they did inpatient care, and now they're in outpatient, and they're seeing their physical therapist for strength and conditioning, and they're seeing their occupational therapist for some help with ADLs, activities of daily living, but there are still functional deficits that they're facing and that they need help with, and so we come in and help there. We work with people with traumatic brain injuries of all sorts, right? And the deficits that come with that, and those are great and many, okay? We work with people who have had hypoxic injuries, so loss of oxygen at some point. What else do we work with?
Vestibular dysfunction.
Lots of vestibular.
Yeah, my dizzy people out there, you really know when you're really dizzy. And so not all dizziness is vertigo. Just putting that out there.
Right.
I know a lot of people confuse vertigo with like traditional central dizziness. And that could be sometimes from an undiagnosed concussion, but it doesn't have to be. It could be pathogenic as well. It could be a viral issue that's actually causing dizziness. And movement disorders.
Yes.
Really. So tics and some, and we can, I guess I'm going to cross with movement disorder to say that we can help a person with Parkinson's disease reach activities of daily living goals
Right.
more rehabilitatively as they synergistically see a neurologist for medication.
Right.
And we have seen that before, and it's been good.
Early onset neurodegeneration.
Early onset.
Right? And so that goes for any of the early onset neurodegenerative type conditions when a patient is wanting just to improve their daily life and
Or to maintain function.
right. They're not looking to, be in a wheelchair just yet. They're looking to preserve as much as they can and to stay as fit and active and having their mind focused and sharp. So those are the things that we can help those guys with.
It's almost like a brain gym.
Yeah, I like that.
Yeah, it's like a gym for your brain. And so for me, it's if this is lifestyle and this is allopathic traditional care, we're just in the middle.
Right.
We're just right in the middle. So you're not unwell enough to be in a consistent allopathic traditional route, but you're not well enough that you can carry on day to day without struggling often.
Right.
Because we had to be introduced to this.
Yes.
Like there was a time in which we were like, what? My first experience with that was like a news article.
Oh.
Yeah. And I saw this kid with one of the educators that we've had in the past that was playing soccer. He had a concussion and he was hemiplegic, meaning that one side of his body was not moving. And then I saw on TV how these doctors were doing some non-invasive therapies. To me, it looked like hocus pocus at first. And some of it can look like that. I mean, we are not privy to,
Yes.
But I was just captivated by it because I was like, why? They were doing figure eights. And so I was like, what are they doing? And that figure eights is an exercise that we do here. And if you've been a patient, you know it's kind of weird. But it works with motor coordination. And so they showed a few takes of kind of like a neurosensory integration type board therapies, eye movements. They showed that. And then all of a sudden they had a take of the kid being a goalie.
Oh, okay.
Yeah, huge. And that for me was it. That was it. I was like, who are these people? What do they do? How do I know? And then we will talk about this in another video. But like some of our previous reasons as to why we came to be in these professions, neurological diseases like were rampant in my family. And so I was like, okay, I just had seen suffering so much for so long for very invasive therapies that I didn't even know non-invasive therapies were an option.
Right.
And so that was really cool. And I guess presenting to people that the word trauma and traumatic brain injury doesn't always go with how therapy needs to be. So what do you got to say about traumatic brain injury therapies? Because I think some of our patients get a little afraid.
Yes.
When they first came in.
I see. Yeah. So and the word trauma doesn't have to always go with brain injury, right? There are many different kinds of brain injury, as we talked about. But when therapies here are, some are very passive, right? Some are very calming and very passive. Some are very active. Because you've had trauma doesn't mean that we're here to continue that trauma. But the therapies are very specific. So, when someone comes in and they do have these functional deficits, we definitely take that into account. What are your goals? What is it that you want to accomplish? Because that really determines, where we're going to go. And then, once we do the testing and try to figure these things out, that also determines what those therapies are going to look like. And so some of them just look fun.
Yeah.
Some of them, like the figure eights, the complex movements, they just look weird, right? And so it's nice to to be in a place where you can see other people going through some of these things. So you realize that, okay, well, maybe this is legit,
Yes.
We're going to all do this together. Let's see. And it's always nice to be in there, and someone that's been in therapy for a little while is there to say, hey, listen, I know it's kind of weird, but hey, these things work, and this is where they're at. So
Yeah. And I think it's a blessing really to be able to offer to our patients just like non-invasive therapies.
Right.
Not because, once again, it's not like we are the end all be all. We
Right.
have limitations. We have referrals that we have to make. We have news sometimes that we have to break to people. But we chose to be these kind of practitioners. We chose this as our toolbox to offer to people. I think maybe like closing remarks are, if someone is wanting to be a patient or want to understand, because I know every office kind of has their own way of, how do I become a patient? How do I even begin to go there?
Right.
What would you say would be the way to kind of make that contact with us or even other offices and get that framework so they understand? I see a barrier to entry sometimes with people that they don't understand that we truly want to hear why you want to come in. We're not expecting you to have figured out what you have going on in order to contact us so we can start that process to figure out what's going on.
Well, I mean, I think it's always good to go to a website and to look at that, right? And sometimes you're going to understand things on there and sometimes you're not. But then to put in a call, because when you're dealing with people at a functional office, they do want to talk to you.
Yes.
They do want to spend the time with you. They do want to understand what it is, what are your goals, what are your challenges, right? And so take a little bit of time, read their websites, call them, talk to their staff, talk to their employees, and then decide where you want to go from there.
Yeah, and I think that's a wonderful thing because some people get so surprised when they call and we talk to them and they're like, oh.
You're the doctor?
Yeah. And you want to hear about this? And I've seen these other people. Are you sure you want my records? And so, yeah, it's very bio-individual. We're not going to, we have a veteran program, which is programmed for a reason. But if you're not a veteran, or if you are a veteran and you don't want to go through the veteran program, we are going to treat you individually.
Right.
And I can say this for her and I, and our entire staff, we start each person off with a clean slate.
Absolutely.
Where are you at? What do you want? How can we help you with where you're at? And so I think that's really powerful. People feel heard and it's great. So if you want to learn more about our clinic at Resiliency Brain Health here in Coppell, Texas, you can go online to resiliencybh.com, fill out a contact form with more dedicated information so that we can contact you as well and do a discovery call with our team. We would love to talk to you, learn more about what it is you have going on, and figure out what are your next steps.